When it comes to breast cancer, there's been conflicting opinions about what age women should start getting mammograms. Is it age 40 or 50? And should you get screened every year?
Renowned breast cancer surgeon Dr. John West has released a new book to clear up some of the confusion for all of us. And he joins us now to tell us more about it. Dr. West, thank you so much for joining us.
It's a pleasure to be here.
During Danny's entire forecast, all we did was pepper you with a million questions because
so everybody else has
curious.
them.
We know that a lot of our viewers have the same questions. So what are your thoughts about mammograms? Age 40, age 50, should they get them earlier?
Start the average woman, average risk woman, no family history, no risk factor, start at age 40, do it every year, and as long as you're healthy, keep doing it. These guidelines to start at 50 are totally based on faulty data. Women will die needlessly. Diagnosis will be made. There'll be diagnostic delays. Women that could have had an easy course end up with a mastectomy and chemotherapy, and their chance of survival goes down. You've got to start at 40. If you have a strong family history, you should talk to your doctor, but start as early as 30. In some very selected case, women with BRCA mutations start MRI screening at 25. So you really have to talk to your doctor who's knowledgeable. The problem is doctors just don't have the time anymore to explain this
Exactly. Well, you devote an entire chapter to cell phones and how they can cause cancer. Explain that.
Well, I was very skeptical at first, but I had a patient come in who said the cell phone was directly over where she got the cancer. And I didn't think much of it, but when we were looking at it under the microscope at the pathologist, they said, well, this is very unusual. There's these little, small invasive cancers throughout this area. And I said, well, that kind of caught my attention. But it wasn't until I got a case about a year later of a young woman who had she was pregnant. She was just breastfeeding at the time. She went in for a mammogram. She was having nipple discharge. It was bloody. They took the mammogram, and she had calcification in her breast that was the same length and width of the cell phone and near the surface. I saw that, and I said, I have a moral obligation because even though nobody believed me, I wrote a paper, and it's been well accepted, and I think people are starting to come around now because studies are showing in some of the animal models that it can cause cancer.
Good. Wow, that is scary. And this is something we were just talking about right now. Let's talk about dense breasts, or how do you know if you have dense breasts? I mean, I was thinking you could tell on a self-examination, but you can't.
You absolutely can't. There is simply no way other than looking at the mammogram. The mammogram tells you whether your breasts are primarily fatty or primarily dense. If the breasts are primarily fatty, they're black on mammogram, and cancers are white spots. So they're easy to see. You don't need any extra imaging. But the whiter they are, i.e. the more dense they are, the harder it is to see a cancer because they tend to be white spots and white background. It's like a snowman in a snowstorm. You can't see them. Wow. But the ultrasound, they just light up.
So we should ask our mammographer, do we have dense breasts and, take out extra?
By law, your doctor's supposed to do all this.
Okay.
But less than 1% of women are actually informed that they need. This is a tragedy because so many women, half the women that have mammograms would benefit by adding screening ultrasound. They double the pickup of small cancers. That's an incredible benefit and a relatively low cost, and they don't hurt.
Well, no doubt you have a wealth of information in your book, and I wish we had more time to talk about it because we have so many questions. But thank you so much, Dr. West, for joining us. And check out his book. It's called Prevent, Survive, Thrive, Every Woman's Guide to Optimal Breast Care. And you can get more information on Dr. West at breastcare.com. Answer all your questions online as well. Thank you very much.
Thank you for having me.
Thank you.
Thank you. I know that we are each other's champions. I got my mammogram yesterday.
She reminds me.
And I go, okay, mine. Now you have to make your appointment. So
2 weeks.
I think that they're huge. So thank you so much for joining us, Dr. West.